In today's video, we're going to discuss the SLUMP test. And so when performing the SLUMP test, there are three key criteria that make a positive test. First of all, it needs to be reproductions of the patient's symptoms. It needs to change with a distant component, and it needs to be different side to side. The SLUMP test is very useful for almost any one of your lower quarter patients, especially patients that are having vague symptoms, anyone that has symptoms of numbness or tingling, and those symptoms that you can't quite figure out exactly what's going on. To perform the test, it's very important that you start off with a standardized starting position. So first, I'm going to have you bring your knees back against the table, feet together, and then let them fall apart, and then hands behind your back. So this is the starting position. Popliteal creases, back against the table, knees together, let them fall apart, and then hands behind his back. The reason it's important to start here is because it allows for consistency and reproducibility of the test over and over again. So if I test him here this time, and then next time his legs are out here, it's going to bias certain nerves in certain positions, and it's going to completely alter the findings of the test. So back to the starting position. Excellent. So another key component of the SLUMP test is you want to know their symptoms throughout each stage of the test. So are you having any symptoms right now? No. No symptoms right now. And I'm going to ask that same question, does this position change your symptoms as I take them through each stage of the test? So is it better, worse, or the same? First component, I'm going to have you slouch down, just from the middle of your back, slouch down. Good. Does that change your symptoms at all? No. Next, I'm going to bring your head all the way down. Is that as much as you can slouch from here? Good. And are you having any symptoms right now?
Nope.
No? As always, in all things physical therapy, check the uninvolved side before the involved side. So we're going to bring out your left leg. Slowly extend this leg here. And then are you feeling any symptoms as I extend this leg?
Yes, I feel stretching.
Where do you feel stretching at?
The outside of my left leg, closer to my glute.
Okay, so he is feeling stretching on the outside of his left leg close to his glute. Is this the pain that you're having?
Yes.
Okay, so it's reproducing the same pain. It's on the uninvolved side as well, so that's interesting. And then we'll see if it changes with the distant component. I'm going to have you lift your head up. And does that change the tension in the glute?
Yes.
It does. So it also changes with the distant component. So if he came in and was having low back pain, and primarily on that side as well, it is the uninvolved side, so that's kind of interesting. But then that would be a positive finding because it meets all three criteria. And then on your real life patients also, don't have them hang out in that position for so long, it wouldn't be comfortable. You can bring that leg down. And then we would check the same thing on this side as well. So we're not going to do that right now. But the next thing I want to talk about in the SLUMP test video is how we can change the position of the lower extremity to bias different nerves. So the test that we just did with him is checking the sciatic nerve, but then there's branches of the sciatic nerve, tibial, common perineal, that we can bias by changing the foot position. So I'm going to have you slump down again. And I'm not going to do uninvolved versus involved. I'm just going to take you through the different nerves. So first, I'm going to have you extend that leg out, just like last time. And then now I want you to turn in your foot right there. So by plantar flexing and inverting the foot, we are biasing the common perineal nerve, and then specifically the intermediate dorsal-cutaneous nerve. So come out of that position. Good. And the same principles apply. He goes in, plantar flexion, inversion. If that recreates the symptoms that he's having, we'll bring the neck up, and that's going to change a distant component, and we'll see if it's a positive test. Last one I want to talk about today is going to be the tibial nerve. Tibial nerve, as we know, runs down the back of the leg and then goes down, wraps around the medial malleolus. So sit up straight. I'm going to have you slump all the way down. Extend the leg out. For the tibial nerve, dorsiflex and evert the foot. So as you can see, the nerve is going to run down the back of the leg, around the medial malleolus. Generally, people are going to report symptom reproduction right through here. Tibial nerve can also often be positive in people that have plantar fasciitis, as there's a plantar branch of the tibial nerve that runs right in the plantar fascia. So, as I've said multiple times throughout the video, change a distant component for it to be a positive neural tension test. So that is some of the key findings that you should look for when performing the SLUMP test.